Hello student, good afternoon. We will discuss on the respiratory system of pigeon. The respiratory system of pigeon. The respiratory system of pigeon is very characteristic and have several modifications in structures. The respiratory system includes respiratory tract. It includes the following structures: external nares. These are a pair of slit-like opening laying at the base of upper beak just in front of the cere or operculum. This is a swollen pad or skin overlapping the nares of open into the olfactory or nasal sacs. Olfactory sacs. Olfactory sacs are situated in the olfactory capsule of the skull. They open into the buccopharyngeal cavity by internal nares. Internal nares. These are slit-like opening on the roof of buccal cavity in front of the opening of Eustachian tube, glottis. It is a median slit opening on the floor of the buccopharyngeal cavity just behind the base of the tongue. It leads into the larynx. It is a small chamber formed by the cricoid cartilages and arytenoid cartilage. The hyoid cartilage and vocal cord are absent. The larynx is followed by the trachea. Trachea windpipe or trachea is a long cylindrical flexible tube extends down the neck ventral to the esophagus. On entering the thoracic cavity, it expands into a chamber, the syrinx, and then bifurcate into two bronchi, each entering its respective lungs. The wall of the trachea is supported throughout its length by bony rings. The first one is complete and bony, while the rest are incomplete and cartilaginous. Sound box or syrinx. It is placed where the trachea bifurcates into primary bronchi. It consists of chamber, the tympanum lined by mucous membrane. Its walls are supported by a last four rings of trachea and first half ring of the bronchitis. At the two junction of the two bronchi is a bony ridge extended dorsoventrally called presulus. It supports a thin fold of mucous membrane, the semilunar membrane. The mucous membrane of the inner wall of each bronchus form the internal tympanium form membrane or membrane tympaniform interna. Similarly associated with the outer wall is external tympaniform membrane. These membranes are controlled and regulated by two sets of muscles. The syrinx sound is produced by the vibration of the membrane during forcefully expelled air from the lungs. The pitch of the voice is altered by changes in the tension by these membranes controlled by the intrinsic syringeal muscle and sternotracheal muscle. Respiratory organs. This is the respiratory tract. The respiratory organs are lungs or air shaft. Lungs or air shaft. The lungs. These are very small, bright, red, compact and non-elastic structures. These are the very small, bright, red, compact and non-elastic structures. They are attached to the thoracic vertebrae and ribs on the dorsal surface and not covered by the peritoneum, which is thick, strong, fibrous sheet called the pleurocostopulmonary or intercostal muscles arise from the junction of the sternal and ventral ribs and inserted in the planal covering are small fan-like muscles. The primary bronchus pierces at the anterior end of the lungs. The bronchus forms respiratory tubules or bronchi inside the lungs called bronchial intercom. In the lungs, bronchus loses its cartilaginous rings and is known as mesobronchus. The mesobronchus enlarges into a vestibule and extends further back, where it is divided into two branches, one going to abdominal ear sac and other to the thoracic ear sac. From the mesobranchius along with the course throughout the lungs arise number of secondary bronchi in two sets, ventral endobronchi and dorso-ectobronchi. The secondary bronchus are rebranched into many fine tertiary bronchi or parabronchi, very fine branching and anastomosing tubules radiate from parabronchi, called air papillaries or bronchioles. Major part of the lungs or lungs parenchyma is made up of the central parabronchus, surrounded by air capillaries showing hexagonal area of unit. Each capillary opens at the ends into parabronchus. The inner surface of air capillaries is highly vascular, through which is the exchange of gases with blood vessels. About 50% the lungs volume is occupied by the network of the thickly packed air and blood capillaries. Air sacs. The air sacs are associated with lungs. Air sacs are associated with lungs. Each air sac is external thin wall with the few nerves and blood vessels, and internally lined with the squamous epithelium and supported by the connective tissues. They are covered by peritoneum. They open in the lungs by ostia. They are filled with the fresh air during the inspiration and then removal air out of the lungs at expiration. Air sacs rejoin the bronchi through recurrent bronchi. There are 9 air sacs, 4 are paired and 1 is unpaired. According to the position they are named. Interclavicular air sac. It is median unpaired air sac connected with both the lungs. It is triangular in shape, situated between the two lines of furcula on either side. It is given out at the growth of the axillary and clavicular air sac, armpit, and then into the humerus bone as the humerus air sacs. Cervical air sacs. These are paired small air sacs arising from each lungs placed at the root of the neck along with vertebral column. Anterior thoracic sacs. These are pair lie ventral, the lungs in the anterior part of the trunk. Posterior thoracic sacs. These are the pair at the posterior of the trunk in front of the abdominal air sacs. Abdominal air sacs. These are the pair lie at the posterior angle of each lungs along the dorsal wall of the abdominal cavity ventral to the kidney. The posterior thoracic and abdominal air sacs are inspiratory air sacs as their air rushes. These during inspiration and remaining air sacs are expiratory air sacs. Functions of air sacs. They gives lightness to the body and reduce. They gives lightness to the body and reduce specific gravity of the body. They acts as a additional respiratory organs. Acts as a reservoir of air. Fresh air is available to the lungs during the expiration and inspiration. They are also cooling device in the regulation of body temperature. This is the respiratory system of pigeon or columba livia. Columba livia. Okay, thank you.